Hello, everyone. Welcome to PCE Final Frontier podcast. I am Shivangi, your PCE guide at PCE Final Frontier, helping one student at a time. Visit our website www.pceff.com to enroll in our courses today. Hello, everyone. Today, we are going to talk about cardiopulmonary for PCE exam. The most important question that is asked to us always is how to improve scores in cardiopulmonary domain. Now, cardiopulmonary domain questions constitute almost 15 to 20% of your entire PCE return exam. So, if you score good in the cardiopulmonary domain, that will improve your score and increase your chances of passing or clearing the exam. Now, how do you improve score in cardiopulmonary domain? There are a few steps that I am going to talk to you about that will be outlined in this podcast, and hopefully that will help you to score great in the cardiopulmonary section. So if you are enrolled with PCE Final Frontier, we have a very carefully crafted timetable which covers the blueprint topics. So you don't have to look anywhere else. You just follow the timetable, follow the topics covered in the timetable, and that's all you need. What you can do is watch YouTube videos to learn some physiology of the heart and lungs, the function, the circulation, the heart sounds, the normal and abnormal rhythm. The third point I would emphasize about some textbooks. Now, there are lots of books that you can read, but then you are never going to finish studying. So the books that you want to follow is O'Sullivan, Reed and Chung, and some topics from Hillgrass, as of course mentioned in our timetable. And you can also talk to PCE Final Frontier mentors to save some times, and they can help you decide which topic is important and which is not. Fourth thing, what you want to do is divide every topic into its pathophysiology, cause, risk factors, signs, symptoms, examination, as in what do you see in patient history and observation, what is the patient presents with. When you do imaging studies like X-rays, MRI, ultrasound, what are the findings, breath sound, heart sounds, etc., like that. What you can also do to improve your understanding, to get a more detailed understanding, is utilize case studies from the textbooks. All these textbooks have case studies mentioned either towards the end of the chapter or towards the end of the book. Just go through the case studies, put yourself out there as a physical therapist, use the case study patient, and think about how will you treat this patient. If that patient comes to your hospital or comes to your clinic, how would you treat these patients? And so you can utilize your learning in terms of application, and that will make your understanding of any topic more clear, will bring more clarity to your understanding. What you also want to do is focus on interventions. Again, think as a therapist, and you can learn about these interventions from these books. Enroll yourself in group studies. Participate in group studies. Find friends or peers that are preparing for the exam. Question each other. Ask, teach each other. And this will give you a better perspective of your content, especially, if you are not super thorough about your topic. Use a study partner if you have one with that person with the study partner, you can discuss everything and you guys can like revise, discuss topics, ask each other questions. This will really boost your understanding. Have open discussions with your friends, mentors, teachers. Ask questions. Do not pretend or assume or think, oh, this is the answer. This is not the answer. Try to get into the depth of the questions, depth of your doubt, and that will help. Most important thing that I would want to emphasize is be consistent. There will be many distractions around family, work, house, workout routines, and the biggest one is the procrastination. Balance out everything. Remind yourself that this preparation for your exam is your priority at this moment. I am not saying that do not work out and just focus on studying, but balance it out. Be consistent, set a routine, and you will be able to score great in this cardiopulmonary section. That's all I have for today. Thank you for joining today. Reach out to us at support@pceff.com for any questions. Follow us on social media on Facebook, Instagram, and YouTube for more content. Have a wonderful week and keep learning.